This is the video on phantom limb. Phantom limb pain occurs when a person has lost a limb but can still feel pain in the missing limb. If you think about it, the limb may be gone, but the afferent fibers from the site of the amputation to the spinal cord are still intact, so the pathway is still intact. The phantom limb isn't only experiencing pain, it can feel other sensations as well, such as heat or cold. Sometimes the missing limb can itch or have a cramping sensation. The illusion of the phantom limb typically occurs early after the amputation and tends to diminish after time. It can be revitalized if there is an injury to the stump. In some cases, the phantom limb can persist throughout the amputee's life. Phantom limb does not just relate to the limbs of a person. In a person with a spinal cord injury, both legs and the lower part of the body can be affected. The person can feel as if the legs are bent up under the body in painful contortions, even though the legs are straight in the bed. It is assumed that after the loss of a major portion of the body, such as an arm or leg or lower half of the body, the brain's somatosensory area will undergo major reorganization. The area that represented the lost limb will begin to respond to other contagious areas of the body. The hand portion may be taken over by the face and the legs by the lower body. This may lead to a person scratching their face and feeling the sensation in the missing hand. The phantom limb is a mismatch between the brain's representation of the body and the actual body part, so it appears that the body part is still there and functional. But this will change over time with the use of a prosthesis or manipulation of the stump through therapy. If the phantom is from a missing limb, typically over time the limb will become shorter, at least mentally. So the leg starts to shorten as time goes by until eventually the foot may feel like it is attached to the stump rather than to the missing leg, or the hand is attached to the stump of the arm. Sometimes using a mirrored box can help the person. The person puts his arm and his stump into two sides of the box. The side with the complete arm has a mirror, showing the reflection of the missing arm. Sometimes seeing the missing arm in reflection can relieve some of the pain, as the arm appears to be normal. Or, scratching the full arm can relieve the missing arm of an itch. Another phenomenon of interest is alien hand syndrome. This can be seen by people with the corpus callosum surgically separated for seizure control, or persons suffering from a stroke or tumor. The affected hand tends to be the left hand more so than the right. The hand seems to do things without the control of the person. It is reasoned that there is a disconnect between thought and action. Alien hand can present as the hand reaching for objects or manipulating objects without the person controlling it. At times, the person does not even know what the hand is doing until it comes to their attention. The person is unaware that the hand is moving. People with alien hand tend to describe the hand as disobedient or naughty. Some even give the hand a pet name or give it a personality. Alien hand is sometimes called a Dr. Strangelove hand after the movie where Peter Sellers played Dr. Strangelove and suffered from an alien hand. He couldn't prevent the hand from doing the Nazi salute. This ends the video on phantom limb.